toys that are sold here in the U.S., generally they're very safe. They undergo extensive testing, and they have strict manufacturing guidelines. You can be pretty sure you're getting the right thing.
Exactly. There are children across our area who are losing their mind with all these toys in front of us. Still, some toys are the cause of children's injuries, even deaths every year. So with so many toys being bought this season, how do you know what's safe and, more importantly, what is not?
Dr. Toni Thompson-Chittams is here today. She's from TLC Pediatrics in Bowie, and she's got some things that we all should remember when it comes to buying for our little ones. Good to see you.
Good to see you as well.
Yeah, thank you for coming.
So I guess what's key is you have to kind of check out the packaging and read the print, because there's information on there, right?
Exactly. It's valuable information, but you're absolutely right. Toys are safer today, and that's because of current law that requires third-party testing of all toys marketed to children in the United States, but parents still have to be very careful when purchasing toys.
Okay.
And looking at that label is very important.
Okay.
And how about that age? I mean, because I have a 3-year-old nephew who's I consider extremely intelligent, and so I will get toys for him that are, I mean, I'll check to see if there are moving parts or, you know, pieces he could choke on, but I do think that some of the older toys he's ready for. But is that something that we have to be really strict about?
Really strict. It should be
so I'm being a bad aunt.
Well, age-appropriate toys, and especially small toys. They are not indicated for kids under 3 years of age just because of an incidence of choking.
Okay. Now this one over here looks like it's for a very young child. You've got big pieces.
It is, exactly.
Is that what you look for?
This is specifically for 6 months and up. And so when you purchase toys for them, you want something that, of course, is large enough for them to grab, nothing that's going to poke them, of course, nothing that's toxic, because the first thing, they're going to put things in their mouth. And more importantly, be careful with toys that have very small, loose parts like button eyes.
All right, look at this one in the front here that you brought. That one looks like it's got small pieces.
Okay, I'm going to move this one for the camera. Yeah. I can't reach.
Do all those little pieces come off?
They do.
Oh, so that's all the...
Okay, here, help me out.
To take it even further,
He's looking at me like, I'm like, it's okay.
Not only is this small piece, but it's magnetic. Just recently, the Consumer Product Safety Commission recalled a lot of magnetic toys because we're ingesting these magnets. And you can imagine if they swallow a couple of magnets, they can get severe intestinal obstruction.
Wow. How does a parent even keep all those pieces together once they get? I mean, if you take this plastic off and you get it home, everything is going to be all little pieces everywhere, right?
Yeah.
I just feel like they'd be everywhere.
Everywhere.
What's up with the? Because I gotta know.
This, this is just an example. You know, if you're buying small toys, if they can pass through that toilet paper roll, then the child is at risk of choking.
This is a toilet paper roll.
You thought it was a kazoo, right?
I know, I'm like, so what are we, like, making toys at home? I seriously thought the doctor had come up with a really great idea.
So this is
a great idea. So if you can pass a toy through here, it's too small.
Exactly.
Okay.
Exactly.
The toilet paper rules.
Such as these jacks over here, right?
Exactly.
Okay. So you get little
you're good.
And these are actually big jacks. But look,
pass right through.
Right through.
So I wouldn't want my 3-year-old and anybody below that to play with that.
Okay, so now what do we have the crayons up here for?
Crayons, crayons are great. I think they're, great gifts. However, be careful with crayons because some crayons can be toxic. If you look on the back of that box, this one particular, it says ACMI, which means Art Creative Material Institute Certified. That means that a board-certified toxicologist have really examined those crayons. And
right there.
Exactly.
Oh, it looks like AP in the middle, and then there's words around it, ACMI.
And so those crayons are non-toxic compared to those crayons.
Guess what's missing?
The label is very vague.
Now,
no
who would know to look for that? Who would know to look for that? That's the fine print.
Yeah, that's why you're the doctor.
So do you stay with a national brand like Crayola, like Fisher-Price? Are those good indicators of what
sometimes cheap is not always the best answer?
Certified or conform to these standards.
See, this one doesn't have it.
Right.
No.
Right.
And this one has it.
Oh, who would know that?
Be very careful.
Good
okay,
point.
What else
very
do we have
careful.
Here?
All right, now with the...
No, we got to talk about the Nerf gun.
Our projectile toys.
Projectile.
Projectile toys.
We're
seeing, and that's with guns and bow and arrows, we're seeing a lot of eye injuries. We're talking about lead lacerations, corneal abrasions. So, again, if you're going to buy a toy such as a gun, make sure age appropriate. Also, you want to look at the maturity of the child, And then if we have to purchase this particular toy, then wear safety goggles.
Okay, throw some safety goggles on them,
Throw some safety goggles.
And here's another part about this particular toy, the batteries required. Parents hate that, right?
Yeah.
They're always having to buy the right batteries and fit them in these toys that constantly need more batteries.
Oh, yeah.
So that's kind of a pain for parents. Okay, what about this stuffed animal or the stuffed little guy here? Is that a good toy or a bad toy?
That's a good toy.
What is it?
That's for a child 6 months and up. And as you can see,
can you hear
nothing, no small loose parts, nothing that the child can potentially chew and choke. It's a great toy. Soft, non-flammable. It's a good toy.
It got our attention. Look, we have totally lost track of what we're talking about.
Now that's a perfect thing for a child that's small enough to be in a crib, right? Because it's soft and cuddly.
It's
and
soft and cuddly.
No sharp parts, no pieces to come off.
Exactly.
Right.
Exactly.
Non-toxic, I guess.
Exactly.
Okay.
Exactly.
And now I see the safety helmet too. So here's the deal, right? You get the kid the bike, get the kid the helmet.
Exactly. Ride-on toys. As pediatrician, we promote kids getting out, getting exercise, and if we're going to get ride-on toys, make sure they have a helmet as well as wrist pads and elbow pads, knee pads. Just make sure that they have the proper safety equipment that goes along with the ride-on toy.
So that would be for a skateboard type toy?
Absolutely. Absolutely.
Like the razors or the roller blades,
especially
any of that kind of thing.
What's wrong with Dora?
Dora, that's actually a good toy. I just wanted to point out a label on that particular toy. If you turn it over,
stand by, I'm turning it over.
Right
here?
There. Exactly.
Okay.
And it says conform to the safety requirement of ASTM, which means American Society for Testing and Material. That means this particular toy has been through some rigorous testing. And
there you go. Look at
all
that.
the standards.
I feel like Vanna White. Look at that.
Yep. All the standards of, federal safety. Federal guidelines for toys.
And then it has a consumer assistance number over here.
Yeah.
So if you got a problem or question, you can call them up.
You can call them up.
What's going on with this
She's not working.
Oh, she does. Press it. There you go.
Oh, okay. And her eyes go up.
Let's let Dora have her time. I shouldn't have pushed that button. Okay, moving.
Okay. Quickly, the telephone. Any pointers about that?
That's a safe one. But be careful with toys or be aware of toys that have long cords or strings.
That could be a choking hazard?
Well, no, you imagine if you have a 12-month-old and they're learning to walk, they can become entrapped in a toy like that and have a severe fall. Right. So the cord should be less than 7 inches. That's, so
less than 7.
Less than 7.
Longer than 7.
That's long, exactly. You may want to clip it a little bit.
Okay.
Yeah.
Yeah, that always scares me.
And the banging toys over there, like the ones you have to hammer in place?
Yeah, that's a great toy.
What's that called? Whack-a-mole or something? Something like that.
Yeah. Great toy, again, for a 6-month.
Not so much for mom and dad, though, because it's like...
A lot of noise in the house.
I'm starting to lose it. But
at least the pieces don't come apart. They're there.
Exactly.
Put them in a room.
Exactly.
All right, so some good online information if people have any questions.
Absolutely.
Couple places where they can go.
I often tell, before they even purchase toys, just make sure you go to the Consumer Product Commission .gov just to make sure nothing has been recalled. Another great website to go to is healthystuff.org. It's an organization whose mission is to just, let the public aware of different toxicity associated with products.
Lots of good information. Dr. Toni Thompson-Chittams, thanks so much for coming in today.
Thank you.
Happy holidays.
Happy holidays to you.